This video is for informational purposes only and should not be used as a substitute for professional medical diagnosis or treatment. Reduction in arterial blood flow in the lower extremities can lead to peripheral arterial disease. ABI is a tool that can be used to identify and monitor the progression of PADs such as arterial insufficiency. Those affected by PAD are at risk for developing wounds, tissue necrosis, amputation, and pain in the lower extremity with activity due to lack of tissue blood flow and oxygen deprivation. Utilized for people with multiple cardiovascular risk factors. The equipment needed for an ankle-brachial index are as followed: a Doppler ultrasound gel, a gown for the patient, a stethoscope, and blood pressure cuff.
To begin testing for ABI, you have the patient laying supine on the mat table with shoes and socks off. When testing for ABI, you use measurements from the arm and leg that are on the same side of the body. In order to form a complete picture of the patient, ABI may be tested bilaterally.
First, apply the blood pressure cuff. Then, apply ultrasound gel and locate the brachial artery pulse with the ultrasound wand. Then pump up the blood pressure cuff until the sound goes away, meaning the artery is occluded. Then release the valve and record the value of the first Korsakoff sound. 134 millimeters of mercury.
Next, place the blood pressure cuff on the patient's lower extremity on the same side of the body, just proximal to the malleoli. Then apply ultrasound gel just distal and posterior to the medial malleolus. Then locate the posterior tibial pulse using the Doppler ultrasound. Then inflate the blood pressure cuff until the sound goes away, indicating the artery is occluded. Release the pressure and record the first Korsakoff sound as the ankle pressure.
.115 millimeters of mercury.
To record the ankle-brachial index, you take the systolic ankle pressure and divide it by the systolic brachial pressure, as seen in this equation. In our patient's case, the systolic ankle pressure was 115 millimeters of mercury, and the brachial pressure was 134 millimeters of mercury, giving an ABI of 0.86. A value of 1 to 1.3 on the ABI is a normal value. Values lower than 0.9 indicate some form of arterial insufficiency.